Good morning, everybody. Y'all hear me okay? Hello? No?
Sorry, we're muted. We're good. So I was gonna ask you, our recording is not working because we don't have space, so we need to call the tech. Is there any way you can send me this recording via email?
Yep, I got you covered. I recorded all day yesterday and I'm going to record all day today as long as I remember to hit the button. So remind me in the second I have to hit the button. I've already hit the button for this part.
Perfect. Thank you so much.
You're welcome. And I'll send you those recordings after they render today. So it'll be this afternoon. I'll send you this. I'll probably send them to that same Dropbox location because that seemed to work okay.
Okay, thank you.
All right. Okay, we left off yesterday. We're kind of in the middle of abdominal ultrasound, and we left off yesterday with the spleen, which is where we're going to continue today. So the spleen is pretty easy to find with ultrasound. It's always pretty much in the same location. It's to the left of midline, kind of lying along the left lateral body wall, whether it be a dog or a cat. So it's a confidence builder. It's easy to find with ultrasound. The spleen should have moderate smooth echogenicity. The echogenicity and appearance of the spleen looks a lot like the liver, except it's not as coarse in appearance. It's much more smooth in appearance compared to the liver. The spleen, remember the acronym SLINKY. So the spleen, when you in a normal animal, when you compare the echogenicity or the brightness of the spleen to the liver and the kidney cortex, the spleen of those three organs should be normally the brightest. So it's the most hyperechoic. Just like we said with radiographs, the spleen kind of has a mind of its own. It kind of can get big, it can get little, it can move around the abdomen, it can lie along the ventral abdominal wall. And a lot of times, as long as the echogenicity is fine and there's no mass lesions or nodules in the spleen, it's just an incidental finding if it moves around and gets kind of big. The capsular margin of the spleen should be a nice white, crisp line. So a very hyperechoic, thin, crisp line, nothing bulging it. The spleen margin should taper nicely. And you'll see here in a minute, very commonly near where the vessels enter into the hilus of the spleen, so the splenic artery and vein, very commonly you'll see these little hyperechoic areas. They represent little globs of fat right near the splenic hilus. They're called myelolipomas. They don't bulge the capsule. They're well defined. They don't shadow, and they don't mean a damn thing. But it's real common to see those on the medial aspect of the spleen. So if I look at this picture here, right up here in the near field, this is the spleen right up in here, and you can see the capsular margins, a nice thin white line. The echogenicity of the spleen is moderate. It's very homogeneous in appearance. You can see here's one of the vessels coming into the spleen. Sometimes even with non-color flow, if you hold your probe still, you could actually see red blood cells flowing through that vessel. And then if you look right where the vessel's sitting, there's little hyperechoic areas here, and they can become pretty big, but they don't mean anything, especially if they're on the medial aspect of the spleen and near the splenic hilus. Those are those myelolipomas. They usually don't mean anything at all. So again, the spleen's very homogeneous. Another difference that you can tell different between the spleen and the liver, besides the spleen being more homogeneous in appearance, is the vessels that go into the spleen. Typically in a normal animal, the vessels will come in here. They may extend for a centimeter or something like that, but you cannot follow them to the periphery of the spleen. They come in just a little ways and then they just disappear. You don't really see them. Unlike in a liver, where you can usually follow the vessels out into the periphery of the liver. You don't really see that in the spleen. And here's the kidney sitting right next to it. So you can tell overall the echogenicity of the spleen is brighter than the kidney cortex, which is normal. Spleen, liver, then kidneys from most hyperechoic to most hypoechoic. If we move our probe a little cranial, here's the spleen here. That's kind of the mid portion of the body of the spleen. This is the head of the spleen where it kind of dives down dorsally and deeper into that area. And so when we're, doing our ultrasound again, it's kind of a real-time procedure in that you will constantly be, with your non-scanning hand. So I'm right-handed, so I typically put a probe in my right hand, and that leaves my left hand to go over here, and that sun is it's really bright out there. So it leaves my left hand to go over here and fiddle with the machine. And so any buttons that I need to fiddle with while I'm doing this. And, obviously if you had this electronically zoomed in or out, you kind of as a general rule, when you're ultrasounding an organ, you would like whatever organ is that is in your area of interest right then to fill up at least 2/3 to 3/4 of the picture. Okay. You don't want to zoom it out so far that this portion of the spleen is all up here. That wouldn't make any sense. Okay. And you don't want to zoom it out too far to where you're cutting off this part that's diving down deeper. And so you always want to adjust the depth setting of this picture where you're electronically zooming it bigger or smaller to where whatever organ you're looking at fills up about 2/3 to 3/4 of the volume of that screen. Okay. So here's another picture of spleen here, nice thin capsule. You can tell the spleen's more hyperechoic than the kidney sitting right next to it. And then if my thing wants to cooperate, there we go. Here's spleen again. There's these little myelolipomas. This is spleen. This is the edge of the liver. Okay. So again, the spleen is more bright and it's a little more homogeneous in appearance than the adjacent liver. Okay, here's another vessel coming into another spleen. So this spleen here, and again, the vessels come in just for a short ways and then they just peter out. You don't really see them, and typically you will not be able to follow that vessel as it tapers out into the remainder of the periphery of the spleen. Here's some more of those little hyperechoic nodules. These are very common to see on the medial aspect of the spleen. Sometimes you'll see them in the middle of the spleen or even over here on the lateral aspect of the spleen, but most of the time they're on the medial location. They don't shadow, they're well defined, they don't bulge the capsular surface. It's the spleen. Those are those benign incidental myelolipomas, which don't mean anything. Okay, so what can happen with some spleen things that go wrong, some spleen pathology? Let's talk about a few benign things. Not uncommonly, this you can see this is all the spleen, and this part of the spleen over here looks pretty normal, except it's got this friend in it, and this area in it is very large. It's hypoechoic. It's kind of mixed in echogenicity. It's rounded, and you can see obviously it bulges the capsular surface of the spleen. So we go back to the thought process that we did in the last lecture, and we try to decide, well, obviously we know that's not normal, but the deal is that we try to figure out, is that thing worrisome? Does it look like it might be malignant? Or does it look like it most likely is benign based on its scanning characteristics? And this is one of those that's kind of got a little bit of both of the characteristics of being benign or malignant. It's round, it's relatively well defined, but it bulges the capsular surface of the spleen. We don't typically like to see that if it bulges the capsular surface of an organ. And it's also somewhat heterogeneous. However, I can tell you this, that not uncommonly, the spleen will get hematomas or hemangiomas, either one in the spleen. So it's pretty common to see dogs, if they get kicked by a horse, kicked by an owner, fall down the stairs, fall out of the car, whatever, fall down jumping in the car or in the back of the truck. If they bang the outside of their abdomen, not uncommonly, it will cause hemorrhage in the spleen, and you get hematomas that form in the spleen. And those hematomas can look really weird. Okay, they can look kind of worrisome for neoplasia, but they're just a big blood clot that happened because the spleen basically fractured. It got traumatized. And so by looking at this, there's no way I could, like any mass, there's no way I could tell you if this is benign or malignant. You would probably have to stick it. And again, I think that, talking to an owner, you always want to let them decide. Your job as a veterinarian is to give them their options, give them their full options. So from most conservative to most aggressive, and let them decide, and they can ask you questions and you can help them decide, but it's their decision. And so in this case, if this animal came in, first off, I would want to scan the remainder of the abdomen. So let's look at the remainder of the abdomen and see if there's any other abnormalities elsewhere in the abdomen. And then I would also very carefully consider the history. Is there a history of trauma? Did he fall getting in the car? Things like that. And then I would also want to know, very importantly, what is the age of the dog? Okay. If this dog, and I saw this on the spleen, if this dog had no history of trauma and he's 10 years old, then I would be a little bit more worrisome that thing in the spleen could be malignant. If this dog is 1.5 and there's a history of trauma, I'm probably going to lean towards it's probably benign, and it might be a little hemangioma, which is a benign growth in the spleen, or a blood clot. thrombus. So you take all that into consideration, and you would tell the owner, well, if you really want to be aggressive, we could put a needle in it. If you really wanted to be even more aggressive, we could just go take the spleen out, because none of us really need a spleen. We really don't know why we have them. And so you can take the spleen out. So that's an option. If the dog is older, the first thing I would want to do is let's get chest films. Let's make sure this, if this is possibly malignant, let's make sure he doesn't have nodules in the lungs already or big lymph nodes in the thorax. And again, you'd want to scan the rest of the abdomen, make sure everything else looks okay. So you use all of that type of information in every case to try to help the owner decide, what do we do now? What's the next step? Okay, here's another example. So this is relatively normal looking spleen over here. It's homogeneous, but it's got this kind of pedunculated or hanging down mass, if you will, associated with it. These connect. Okay, and if in real time you would kind of move your probe back and forth, and you can see that they connect, and there's fluid around them that's free fluid in the peritoneal space. And if I look at that fluid real closely, it looks like it's not pure black. It's got little speckles in it here. It's got a few little speckles in it here. So there's a good chance there's some type of cellular debris in that peritoneal fluid. So being this has a large mixed echogenic pedunculated mass associated with the spleen, there's a good chance that's leaking blood, and this may be hemorrhage in the peritoneal space. Okay, so again, is that benign or malignant? I can't tell you. You can put a needle in it and try to figure it out. Although if it is leaking already and we've got a hemo abdomen going on, probably the next best thing is just go take the spleen out surgically and then send this off for histologic analysis. Malignant splenic disease, we talked about this. This is an animal that was showed his liver on the last section, but this used to be a spleen. There's nothing about it right now that looks like a spleen. So it's a very good chance, because it's so bizarre, so it's deranged in its architecture, big mixed echogenic areas, a cavitary region in the middle of it. Good chance it's going to be some type of splenic neoplasia. And again, the types that you would consider would be lymphoma. Hemangiosarcoma is a common one that can happen in the spleen. This is a radiograph of a dog here. And if you look, obviously there's a very large mid-abdominal mass in the ventral abdomen causing a mass effect. It's pushing all the small bowel and the colon away from it. It lives, and again, we're back to those little blue charts that we talked about for abdominal radiology. Really good chance, based on where this is located, it's associated with the spleen. So we know it's most likely a splenic mass. And again, we ultrasound it, and that spleen looks like this. And so again, if this dog is 10, I'm going to bet neoplasia, probably $100 on neoplasia on this case. So it just is very bizarre. It's solid, mixed in echogenicity, kind of a swirling like architecture. Be real easy to put a needle in it, look at the cells, or just take the spleen out and be done with it. And again, with that particular animal, we want to make sure and look at the thorax. So we want to get thoracic films. I don't see anything in the lung. I don't see any nodules, but he's got this guy here, which is huge. And I think Dr. Warner taught y'all thoracic radiology. Y'all know what that is right there? Remember? Very good. That is a really enlarged, great big sternal lymph node. Okay. Remember, there's 3 groups of lymph nodes that live in the thorax, and you normally shouldn't see any of them in a normal dog. Well, the sternal node lives right here, usually just dorsal to about the 2nd or 3rd sternobrae. That's the sternal node. The second group of lymph nodes, as I'm sure you know, is up here. The cranial mediastinal lymph nodes can get huge up in this area. And the third group of lymph nodes in the thorax are the ones that live in the tracheobronchial region. Those are called the tracheobronchial lymph nodes. Okay, so those are the 3 areas in the thorax that we have lymph nodes. In this particular case, this sternal node is really big. Anybody have any idea why that sternal node would be big in the dog that has a great big splenic mass and probable hemorrhage in his peritoneal space? Very good again. And the reason being is that this sternal node, what does it drain? It drains the peritoneal space. Okay. So the sternal node drains the abdomen. So all of this fluid in the abdomen, the hemorrhage, if it was a case of pancreatitis and peritonitis, all of that drains through a lymphatic duct into the sternal node, which filters that area. It kind of does its lymph node job. and filters that area, but the sternal node drains the abdomen. Okay, so this node is big because something is going on in the abdomen. So anytime you see thoracic films, you should recognize that's a big sternal node, and then you think, aha, the sternal node, even though it's way up here, it really is associated with draining the abdomen. There's something wrong in the abdomen anytime you see a big sternal node. Okay, and so this obviously this mass is very large and ugly and doesn't look anything like a spleen. This is a pretty classic appearance of lymphoma in a spleen. It can look like this in the liver too, but this is a big spleen, and it's got all these little pot shots, all these little very small but kind of similarly sized hypoechoic nodules throughout it, and it becomes really apparent, and it almost can look like a honeycomb like appearance. And the spleen's big, the margins are rounded. If you would palpate the dog, the spleen's going to be huge. It's going to be kind of hard in its appearance. And again, real easy. You stick a needle in here using your ultrasound probe, you get some cells, and it's a real easy diagnosis on cytology to diagnose lymphoma. Okay, moving along. Now we're going to talk about the kidneys. So we know where the kidneys live. Radiographically, we learned where they live and how big and they should be. Keep in mind that, again, radiographs are better to judge the relative size of kidneys. And by that, I mean, radiographically, we have the built-in control of the length of L2 that we use to measure the length of the kidneys and are they normal in size or not. And the cool thing about that is obviously the length of L2 and the size of the kidneys is going to be the same. The relative of those two measurements is the same whether you're talking about if it's a Chihuahua or a Great Dane. Okay, so it fits with any dog. If you compare the kidney size to the length of L2, ultrasound is fantastic and very accurate for measuring the length of the kidneys. But I can't tell you if I measure the length of the kidneys, is that normal for that particular dog? That's why radiographically, it's better to do the rule of L2, the length of L2 to compare to the kidneys, okay? So typically with ultrasound, the left kidney is much easier to find than the right kidney. And the reason for that is when you're trying to ultrasound the right kidney, right ventral to the right kidney, so right next to the right kidney, typically is the cecum. And in a dog, we know the cecum is very prominent and gas filled. And typically gas and ultrasound don't like to play together. And so ultrasound waves typically will not penetrate through gas. And that makes everything underneath that area hard to find, including the right kidney. Same will go for the right adrenal gland. The right adrenal gland is a lot harder to find than the left adrenal gland for the same region. The kidneys typically are going to be symmetrical in size. They're not going to measure exactly the same size, but should be within a few millimeters, maybe plus or minus 10% of each other in a normal animal. The cortex of the kidney is very homogeneous. It kind of looks like spleen, except it's usually not as hyperechoic as the spleen. Remember our spleen, liver, kidney thing. And the cortex is hyperechoic in the animal, but the medullary region is very hypoechoic to almost anechoic. Okay, so and that's very different than human kidneys, and I'll show you an example of that here in a minute. Where the cortex joins the medulla, it should be relatively well defined. So you should have normal, well defined corticomedullary definition, or the corticomedullary junction should be well defined, where the cortex meets the medulla in the kidneys. With good ultrasound and good ultrasound machines, which the majority of them are now, you can see pretty good details all the way in the kidney down to the level of like the arcuate arteries, which are the little branches from the renal arteries that lie in the region of the cortex where the cortex joins the medulla. And again, radiographs are better for relative size of the kidneys, so better at telling you that the kidneys are normal in size for this exact particular animal. So here's a longitudinal section of a kidney. Again, same thing that we talked about. This is always cranial. This is always caudal. This is always ventral because we have the dog lying on their back. And so that's ventral. That's where the probe is shooting sound waves in that way. This is going to be dorsal. So right in here, there's a kidney. Okay. And you can see it's shaped like a kidney. Okay. And the cortex, capsular margins, this nice, crisp, bright white line. The cortex is all of this gray area around in here. The cortex itself is relatively homogeneous. And inside the middle of the kidney, you have these little scalloped areas right in here. And these blacker areas, almost anechoic, is the normal medulla of a dog or a cat kidney. And where the cortex joins the medulla, it's relatively well defined. Okay, so I can see pretty easily where the cortex joins the medullary region of the kidneys. Okay, and if I measure this kidney here is 3.8 centimeter in length by 2.3 centimeter in width, and that's fantastic. That's accurate, but it still doesn't tell me if that's normal in size or normal in size for that particular animal. That's why radiographs for kidney size, relative kidney size, are better. Okay. Here's another kidney. So again, here's kidney here, and these are the kidney cortex. The capsular surface looks good. Here's the medullary regions of the kidneys. Okay, these little indentations that kind of divide the medullary region, those are called the renal diverticuli. In people, they call them the renal calyces, I think, but they're not. That's not really appropriate for animals because of what makes up that area. So these are renal diverticuli in dogs and cats. Okay, so cortex, medullary regions, good corticomedullary definition, shaped like a kidney. It's not lumpy, bumpy. It looks like a pretty healthy kidney. Okay. This is that same kidney. This is in a dog. So that's a dog kidney. This is a human kidney. Okay. This is a normal human. This was one of my technicians years ago who volunteered. And so we looked at their kidney, and human kidneys are poorly defined. They look ugly. They don't have much in the way of definition between the cortex and the medullary regions. It just is an ugly looking kidney that humans have. That's normal. And the only reason I show you this is, and I've had this happen quite a bit, is I will have human physicians, and again, my parents used to always say, why didn't you become a real doctor? And so I always call them RDs instead of MDs. So if you have an RD that comes into your practice and you're ultrasounding the dog and they're kind of watching you, or you show them a picture of their dog's kidneys, if they know anything about ultrasound, especially if they're a human radiologist, they're going to go, oh my God, you idiot veterinarian. My dog has hydronephrosis. Because if the human kidney looked like this with these well-defined areas of the medullary area and here, they're going to have diagnosed hydronephrosis. And then that's when you say, well, no, you dumbass. Or you dummy, you're a physician. You just treat one species. We treat all the rest of the species of animals that lives in the world. Okay. And there are things called species differences. I feel for you because I know you don't know that, but there are species differences. Okay. And so when you look at this, this is a normal appearance of a dog and cat kidney. It's not hydronephrotic. And so you remind the physician that there are other types of doctors aside than human doctors. Okay, normal cat kidney, dog kidneys look exactly the same. That slide, I don't really know why it's even in there. That's a video, but I don't think it plays, so we're not going to worry about that. It's the same thing. There's another one. Okay, so now that we know what kidneys should look like in a dog and a cat, what's some benign things that can happen to kidneys that you're going to see? Well, one of the biggest ones is, again, if you were at the radiology craps table in Vegas, and again, I use that analogy a lot because a lot of what us radiologists do is, when we read a case out and we dictate a report, a lot of times we don't know 100% what it is. And so what we're doing is using all the information, the animal signal, the history, what we see on the radiographs, any other bit of information we can get, and we give you our best bet. What's our educated opinion? What's the most likely thing that is wrong with this animal based on all of the stuff that we know? Okay, history, signalment, clinical signs. We want to know physical exam findings, orthopedic exam findings, neurologic exam findings, along with the images that we see. And we put all that information together and we come up with a differential list that's reasonable. And we say, of all these three things that this could be, I think this is the most likely. Okay. A lot of times we don't know for sure exactly what it is, but we give you the most likely. And so basically we're betting the odds, which is the same as going to the radiology craps table in Vegas. Okay. So if you're at the radiology craps table in Vegas, and again, the question is, what organ in a cat typically will that cat outlive? And you're always going to bet what? You're going to bet kidneys. Okay. Cats outlive their kidneys. So if you show me any cat that's 10 years of age or older, that cat is most likely in some degree of renal insufficiency, some degree of mild chronic renal failure. And as the cat gets older, it gets worse and worse and worse. Okay. Why that is, I have no idea, but cats tend to outlive their kidneys. So one of the most common thing you're going to see as a small animal practitioner is in older cats, chronic renal disease, idiopathic age-related chronic renal disease. Okay. And typically what you see and what you need to know for an exam would be this. In a cat that has chronic renal disease, the typical sonographic appearance of the kidney would be it is hyperechoic, it is small and misshapen, and there's decreased corticomedullary definition. And sometimes you'll get little areas of mineralization in the kidney. So let's look at this kidney of a cat that has chronic renal disease. Here's the kidney. Okay. The kidney, if you compare the cortex of this kidney to the liver or spleen, it's going to be more hyperechoic than it should be. And I don't really see those well-defined rounded areas of medullary region in this kidney. And that's because I have decreased corticomedullary definition. I don't see that well-defined area between the cortex and the medullary regions. And I can see these little hyperechoic areas, and it looks like some of them are casting a shadow. So these are little punctate areas of mineralization, most likely in the renal diverticuli of that kidney. And if you measure that kidney, I don't know what it measures. That's a centimeter. If you look down here, that's a centimeter from here to here. So if you eyeball it, I don't know, maybe 3 centimeters long, something like that. So it's on the small size for a cat kidney. Okay. Here's another cat kidney. So again, these little focal areas of mineralization. Here's a little bit of medulla, but again, we have decreased corticomedullary definition. The kidney's still oval in shape, but it's a little lumpy, bumpy. It's got some areas around it that are kind of irregular in shape in that area. So what you need to know again, chronic renal disease in a cat sonographically is going to show up small, hyperechoic, misshapen kidneys with decreased corticomedullary definition and faint mineralization in the kidneys. That's typically what you're going to see in a cat. Okay, here's another cat. So again, misshapen, kind of a divot right here in the kidneys. This the caudal pole of the kidney here is flat. Okay, the kidney cortex is hyperechoic. We have decreased corticomedullary definition. This is a stone that's sitting in the pelvic region of this kidney with shadowing. Okay, he's got a little bit of what we call pylectasia. So there's a little bit of fluid accumulation in the renal pelvis, because this stone is there and that fluid can't get out. That fluid is urine and it can't get out very easily to go into the ureter because there's a stone in the way. So it tends to back up in that area of the kidney. Okay. So small, hyperechoic, misshapen kidneys, flat here. And that kidney, it's measures about 3.8 centimeter. And, you do that in, 3.8 centimeters, about 1.5 inches. So it's pretty small kidney. This one here's also small, hyperechoic. This one still got good corticomedullary definition though, but hyperechoic kidney cortex, it's small. And if you look real close and you turn up your imaginoscope in your head, you can also say there's this part of the cortex, it may be flat, but it's also focally hyperechoic. Okay. And if I show you, well, I'll show you here in a minute, and another one, hyperechoic, keep that in mind going forward. Okay. Here's another kidney. So this is a centimeter between here and here. Okay, so this is 1.5 centimeters long for a cat kidney. So that's 1/2 inch. Okay, that's 1/2 to 3/4 inch long. That cat kidney is teeny, and they can get so small it's hard to even find them, and it's hard to recognize them. That's a kidney. You kind of have to think about it, and you have to think, well, this is a really old cat with chronic renal disease, and I don't see a normal kidney, and this vaguely looks like it's shaped like a kidney. So that may be his really small, chronic renal diseased kidney, okay, which is what it was. Okay, obstructive renal disease. So what are some things, and I'm going to put your common sense filter to the test here. What are some things that can cause obstruction of the kidney? So by obstruction, we mean anything, the kidneys make urine, and once they make the urine, they put it in the renal pelvis, the collecting system, right? And so it dumps its urine in the pelvis of the kidney. And from there, that urine should flow from the pelvis through the ureter. So it goes through the ureter on each side, and that ureter takes the urine down to the urinary bladder. It's stored in the urinary bladder for a period of time until we got to pee, and then it passes from the urinary bladder out through the urethra, right? So that's the typical scenario. So obstructive renal disease can be anything in that ureter, in the bladder, or urethra that is not letting urine flow out of the kidney. Okay, so what are some things that can cause obstructive renal disease? Well, common sense that would tell you, well, if you had a problem with the kidney itself, and let's say you had a mass in the renal cortex, whether it's a cyst, benign, or malignant, like a carcinoma, and that mass gets so big it squishes the renal pelvis to where the renal pelvis has no room to hold any fluid, then that urine that the rest of the kidney is making has to go somewhere. So it backs up, and then that renal pelvic region becomes super dilated, which we'll talk about. That's a condition called hydronephrosis. Okay. Another thing that could cause an obstruction is there's something wrong with the ureter. Okay. So what can happen in the ureter? Well, most commonly, you're going to have a stone, one of those little hyperechoic stones that can form in the kidneys, in the renal diverticuli, and it breaks out and it floats down the ureter and gets stuck in the ureter. Okay. Again, that's really common, especially with cats, because a cat ureter is probably only a millimeter in diameter. Okay. It's really low. So it doesn't take much of a stone to get stuck in a ureter as it tries to pass through it. Okay. So a stone that gets stuck in a ureter can cause obstruction. Another thing that can cause obstruction is if you have a ureteral stricture. So this is a focal narrowing of the ureter. And you would get ureteral strictures for usually one of about two reasons. One of the reasons is you have teeny little stones that constantly, intermittently pass through the ureter. And as they do, every time they pass one, it kind of scars the mucosal surface, the inner portion of the ureter. And it scars it, kind of makes, it scratches it, let's say. And so you get this little scratch inside the mucosal surface of the ureter, and the body tries to heal that up. So as it heals it up, it puts a little scar tissue right there. Okay, well, you do that too many times, and that scar tissue is going to occlude the ureter and cause a stricture. Okay. The other thing that can cause it would be trauma. So you have trauma and you damage your ureter. The ureter leaks a little bit, and then as the body heals it up, again, it strictures down to fibrosis or scarring. Okay, so all of those can cause an obstruction of a ureter. What's another thing that can cause obstructive renal disease? Well, keep going down further the list. So if you have a mass lesion in the urinary bladder, especially a mass lesion that lives in the urinary bladder in the trigonal region where the ureters enter into the bladder, then that can cause obstruction of urine flow trying to go from the ureter into the bladder. And we said a very common tumor that lives in the bladder, and it happens to live most all the time in the trigonal region, is a transitional cell carcinoma. So a transitional cell carcinoma mass lesion in the bladder can cause that problem, obstructive renal disease. Severe cystitis can cause it. Severe prostatitis or prostatic neoplasia can cause that because it will obstruct the urethra. Okay. If you have a stone that's stuck in the urethra, that can cause obstructive renal disease. Now, putting your common sense hat on, again, let's say you ultrasound a cat or a dog, and one of the kidneys is fluid filled and has a really dilated renal pelvis, and the other one looks normal. Okay. More likely is the obstruction going to be in the ureter or in the urethra or in the urinary bladder if only one kidney is affected. Very good. Again, y'all are on top of it today. So if it's unilateral hydronephrosis or a dilated kidney, most of the time it's going to be something that's in the kidney itself or the ureter. Okay. If it was in the bladder, the problem was in the bladder or the urethra, why wouldn't both kidneys be obstructed? Okay. So most likely if it's unilateral hydronephrosis, it's going to be something in the ureter, probably not in the urinary bladder. Sometimes you'll have a mass lesion in the urinary bladder that lives in the trigone, but it only lives off to one side. So it only may obstruct one ureter. So that's a possibility, but going to be a little more unusual. Okay. So here's a kidney. This is a kidney here, and this is the renal pelvis. Normally the renal pelvis should be nice and thin, and you hardly ever see it, just a little slit. But if urine is being made by this kidney and it can't go out the ureter, then over time that pelvis will dilate and become a little bigger and a little more prominent. Okay, so here we get a little bit of fluid accumulating in the renal pelvis. So that's very mild hydronephrosis. This is the renal papilla. So again, this is a kind of a transverse view of the kidney. Normally this area here, that's the collecting system of the renal pelvis. and it's a little dilated because it's got this fluid all accumulating in that area. Normally, you shouldn't see it at all. If you do, it's going to be just a little bitty sliver of a slit right in there. Okay, so again, you can see that area is a little bit dilated, which would go along with mild hydronephrosis. This is a sagittal view of the kidney again. Now we have this large area in here that's really dilated. This is basically a dilated indon ureter where it comes into the kidneys kind of coming right at you. So that's moderate hydronephrosis. Okay, same thing on that one here. Hang on, I'm trying to get it to change. This is another animal that has hydronephrosis, but now we have in that collecting system not anechoic fluid, it's full of this echogenic debris. So this one here probably has pus in the kidney or hemorrhage that's causing the echogenic debris in that dilated portion of the kidney. This looks like pretty normal kidney here. There's cortex, there's medullary region, but this is a dilated renal pelvis. This is the ureter coming out. Normally with ultrasounds, you do not see ureters. Okay, they're so small, even in a big dog, you will not see a ureter in a normal animal. If you start seeing a ureter that's dilated coming out of the kidneys, that usually means there's something stuck in the ureter or mass in the bladder. Okay, this is severe hydronephrosis. So if you look here, this is the kidney cortex up here. Okay, this whole thing's the kidney. Okay, that's the cortex. These are those little diverticular areas in the kidneys. So these used to be the medullary regions, but all of this is a hugely dilated renal pelvis. So the kidney still trying to make urine. It's making urine. It collects in there, has nowhere to go. So this starts to fill up like a balloon. Okay, and it can become so severe that it thins the cortex over time, and eventually there's so much pressure on the cortex, the kidney can't function anymore and quits making urine altogether. And because now we have this collection of warm urine sitting in here, and the other end of this has access to the outside world through the urethra, this over time, we have stagnant fluid in here will usually become infected, and then you have pyelonephritis, which is an infection of the kidney on top of it. So by the time the kidneys get this severely dilated, usually removal of the kidney is about the only thing you can really do. And if you follow that kidney down here, the ureter's coming out in here, and you follow the ureter down, again, a normal ureter you should see. So this was kind of halfway down between the kidney and the urinary bladder. This tubular kind of tortuous area here is a hugely dilated ureter. So it's measuring about 1 centimeter or 2 centimeters in diameter. And you can trace it all the way down caudally, coming back over here, and you would eventually follow it, and you can trace it right into the urinary bladder. Okay, this is, remember I told you on that last one of the kidneys we look at that caudal cortex, and there's this, if you use your imagination, there's this little hyperechoic area in the cortex. And in a lot of cats, especially dogs too, but mostly cats, these are called renal infarctions. So this is a little area of necrosis of the cortex of the kidney and becomes hyperechoic and kind of triangular shape, kind of this broad-based triangle that lives in the cortex of that kidney. So basically what happens in these cats is that in the blood supply of the kidney, so the renal artery comes in and it branches, and the little arcuate arteries kind of live in this area around where the cortex joins the medulla. Okay, and if there's a little blood clot or a little thrombus that forms in that arcuate artery, the arcuate artery supplies oxygenated blood to the cortex. Well, if a thrombus is in there, then we're getting no oxygenated blood to the cortex of that kidney, and so it dies. Okay, it's an infarct, just like that would happen to people when they have heart attacks. Okay, and so it's an infarct. So that part of the kidney dies, and the body says, "Oh shit, what do we do? I have to take care of that." And so what it does is now we have a bunch of dead tissue there, and so the first thing it does is that tissue will shrink down, it atrophies, and then it becomes fibrotic. So we put scar tissue in there. Okay, well, that fibrosis tissue, that fibrotic tissue, is hyperechoic. Okay, and that's what forms this hyperechoic, broad-based triangular appearance. And if you look here, now we have a divot of the kidney. Okay, and if you look and use your imagination, there may be another little triangle right in here. So over time, not only will you make that area hyperechoic and it has no function, then over time it shrinks down even more and will cause an indentation or concavity of the kidney. You may have another one starting to form over here. Okay, and you can imagine if this happens in multiple places of the kidneys, then we're going to the end result in these old cats that have chronic infarctions are small because the kidney shrinks down, misshapen, hyperechoic kidneys. And so my theory, and I have no idea if this is right, but my theory, the early reason why a lot of these cats outlive their kidneys and go into chronic renal disease is I would bet that over time, they start getting these little micro infarcts of their kidneys, which the end result of that is small hyperechoic misshapen kidneys. Okay, I don't know, but it's a theory. Okay, ethylene glycol is, the other name for that is antifreeze. So antifreeze toxicity, and we know that dogs in particular eat really weird things. And in this particular case, some dogs love the taste of ethylene glycol. I've never tasted it. I have no idea, but dogs like to lick it off the garage floor if it's leaking from the car or leaked out of a bottle, right? And so we know ethylene glycol is supremely toxic to kidneys, and it will cause within a few hours changes of the kidneys that are irreversible, and within a few days, usually death. And there's really no good way to treat these. You'll learn that in internal medicine. It is one reason why, and I say one reason, why most veterinarians will keep a bottle of Everclear around in their cabinet somewhere, because you can treat these dogs with pure grain alcohol because it competes for these sites that these crystals are kind of forming in the kidneys. So it will help to combat it. But again, the prognosis for these dogs is really poor. On the other hand, back to ultrasound, what does ethylene glycol look like in a kidney? Well, it causes the cortex to become really, really hyperechoic. The kidney still has normal size, normal shape, but within hours, maybe even 30 minutes after drinking ethylene glycol, if you ultrasounded these kidneys, they're really, really hyperechoic. Okay. And that's because we're getting crystal deposition of this ethylene glycol that gets stuck in the cortex and is causing damage to the cortex. If you give it a little more time, 6 to 8 to 12 hours, then the medullary region of the kidney will also become hyperechoic. And then the whole cortex and the medullary region are both hyperechoic. So that's the typical what you'll see in a kidney with ethylene glycol toxicity. Not to say that is the way to diagnose it. There are blood tests now that work to diagnose it a lot quicker, but you'll see these changes in the kidneys that accompany that pretty early on. This is a cat. This is actually one of my cats a long time ago. So here's the kidney here. We got a little dilatation of the renal pelvis. We got the cortex around the kidney here, but it also looks like around the kidney in the capsular area, we got this little bit of fluid accumulation with got echogenic debris in it. So around this kidney here, that's the edge of the cortex, but we got this little halo. You can see it down in here of fluid. So that would be, we would describe that as perirenal fluid, a little bit of fluid around the kidneys, right? And that's a very common finding with pyelonephritis, especially in cat kidneys. A little mild dilatation of the renal pelvis, and we get this halo of hypoechoic fluid between the cortex of the kidney and the capsular surface. Okay, so if you see this hypoechoic fluid accumulation around the kidney, a lot of times that's due to a bacterial infection of the kidney itself. Okay, cystic things in the kidneys. Cyst, again, like we said before, most of the time, if you see a cyst is benign. Okay, it can get really, really big and put pressure on the kidney and cause renal failure, but the cyst itself is benign. Okay, and so we described how you would normally, sonographically describe a cyst: thin-walled, round to oval in shape, anechoic fluid with a little bit of posterior enhancement would be the definition of a cyst. Okay. We also know that some of these animals can get multiple cysts all over the kidneys. So it's got a big cyst area. It's got little septations in it, another cyst area, another cyst here. So this dog's got multiple cysts, or cat, whatever one it is, in the kidney cortexes. And again, if they have 2 or 3 of these, usually it's an incidental finding. The cyst doesn't cause a problem. On the other hand, if you have one of these flat-nosed cats like a Persian or a Himalayan, they can get really bad, severe polycystic kidney disease, and the cysts can become huge and they can coalesce together to where the cysts are so big, the cysts are taking up the great majority of the kidneys. And that's when you can run into renal failure, because now we have cysts living in the kidneys. The cysts themselves are benign, but they get so big, they put pressure on the kidneys and kill the kidney. Okay. And so that's what can happen in severe polycystic kidney disease in these animals. And we got to take a break here, so I'm going to talk this real quick. So if you have a breeder, and again, anytime I have a breeder come in, I put a big X on the chart. So if you have a breeder that comes in, and especially if it's a cat breeder, and that would get like 3 X's. okay, on the chart. So if you have a cat breeder that comes in and they breed Persians and Himalayans, and that would be like 5X's on the chart, right? And so if they come in, they're going to say, hey, doc, my cat just had kittens and I want to sell these kittens for a lot of money each, and we know that everybody knows that Persians and Himalayans get polycystic kidney disease and it's heritable. Can you screen these cats with your ultrasound machine when they're 6 weeks of age? And can you guarantee that these cats don't have polycystic kidney disease? And your answer to that should be no. Okay. And the reason being is that even though this is a heritable condition, that a lot of times it will not show up in the kidneys at all until the cats are like 6 months of age. Okay. So you don't want to sign off on that and say, yeah, at 6 weeks, at 8 weeks, they all look great. Well, give it another few months and they may have horrible polycystic kidney disease. Okay. So you don't want to get in that trap. You'll end up with an issue. So here's a radiograph, lateral view of a dog, obviously mass effect. This time, instead of being ventral abdomen where the spleen lives, it's dorsal abdomen, causing a mass effect and severe deviation of the colon ventrally and portions of the small bowel. We know from our blue charts and from this discussion of kidneys, that's most likely a kidney issue. So this is a weird condition that you will see. This is the kidney. The kidney's a little bright. It's got corticomedullary definition. But the kidney itself doesn't look that bad. But if you look, what's around the kidney? Well, it's got this huge fluid area around it, and I don't see all of it. So there's some of it that's hanging over here. So we need to adjust our depth of our ultrasound machine so we can see where that ends, right? Now we adjusted our depth. So here's the kidney. Now we can see the full extent of that fluid area. So this is a thing called a perinephric pseudocyst, which take that word apart, and that means perinephric, around the kidney, pseudocyst, which is kind of like a cyst. So kind of like a cyst surrounding a kidney. And that's exactly what this is. So this animal has this large fluid opaque cystic area around the kidney. Okay. And actually what's happening here is the fluid is dissecting between the renal capsule, which is out here, and the cortex. And over time, that capsule stretches to a point where now it can't stretch anymore. And then the more fluid that accumulates, it puts pressure on the kidney and will lead to renal failure. Okay. So if you see something that looks like this, you got to realize that if there's fluid around the kidney, they're going to silhouette. So the fluid around the kidney will silhouette with the kidney itself. And radiographically, it looks like one big soft tissue opaque structure. Well, that's where ultrasound comes in, because now we can differentiate. Here's the kidney. The kidney itself doesn't look that bad, but it's got this huge cyst around it, which is one of these perinephric pseudocysts. If you catch these in time, a surgeon can go in and they actually cut out a large portion of this capsule, and that will allow this fluid to drain into the peritoneal space, takes pressure off the kidney, and that fluid is then resorbed over time in the peritoneal space. Sometimes if you take just a little nick out of it, they can reform. Sonographically, you can go in and stick a needle in here and drain the fluid out, and that puts relief on the kidney and makes the animal feel better. But if you just use a needle, most of the time that little hole where you stuck the needle in is going to seal up and this will reform. Okay. So those are perinephric pseudocysts. So let's take our break. We're going to come back and talk about renal cancer. All right. I will see you in 10.